Many organizations have been doing important, innovative work in their local healthcare environments to try to alleviate and solve problems related to bias and discrimination in medicine. One factor that may affect diversity in residency programs, including variation in socioeconomic status, is cost of living considerations. I'm Stephen Morrissey, managing editor of the New England Journal of Medicine, and I'm talking with John Patrick Coe, Vice President of Education at Mass General Brigham and an Associate Professor of Pediatrics at Harvard Medical School. Dr. Coe has co-authored a perspective article about implementing a stipend program to address financial hardship in residency. This is part of the journal's series of brief case studies of anti-discrimination initiatives. Dr. Coe, how did you and your colleagues identify the need for a financial intervention to support your institution's residents? And then what was the goal of that intervention?
Really, we know that the cost of living is high in Boston, where our training programs are based. And we wanted to think about ways to address that as a financial barrier for applicants to rank our programs as highly as they would like to without as much consideration of being able to afford living here.
So then how did you settle on the details of the intervention, the amount of the stipend, which residents would be eligible to receive it?
We spoke to different groups, different stakeholders. This included people at the institution, both in the GME office, but also other people in hospital administration, human resources. We also actually importantly talked to residents and other program leaders to determine what would a meaningful program be to make a difference in the barriers that we mentioned earlier.
So in fact, you say that it was important for the stipend to positively affect recruitment. What features of the program were designed with recruitment specifically in mind?
We thought, after some discussion with all the stakeholders, that there were three main factors that were essential for the program to positively influence recruitment. First, the stipend amount had to meaningfully affect the residents' ability to afford living in the Boston area. Second, it was important for applicants and potential applicants to know in advance whether they qualified for the stipend. So when they were making decisions about which programs to rank highly, they had to know whether they were going to be eligible. And last is that the applicants needed to be assured that their utilization of the stipend was confidential and not linked to the selection process.
So you say in your article that what you're describing is the pilot phase of the intervention. What were the results of that pilot phase, and how did you determine whether the program was actually meeting the goals that you had established?
We spoke with administrators beforehand, hospital leadership, to gain support to actually pilot this program. And what we did for outcomes was to kind of just look at the numbers of the applicants who ultimately decided to come, who were eligible for the stipend. And then we also actually asked them in a survey afterwards what the meaning of the stipend program was to them in terms of matriculating or ranking our programs as highly as they wanted to. So we did look at the number of residents who received the stipend, and we saw that 133 incoming residents received the stipend during the pilot years. And then when we surveyed the residents who came, a very high proportion of them felt that the stipend really impacted their decision in terms of how highly they ranked our program. 82% rated the stipend extremely helpful in that regard.
So the pilot phase that you're talking about ended with the 2020-2021 recruitment cycle. What's happened to the program since then?
We reviewed the program results with leadership in terms of the number of people coming and also their feelings on the impact of their decision making. From that review, we in the leadership concluded that the program was making a meaningful impact in terms of our applicants being able to address some of the financial challenges of living in the area so that they could rank our programs as highly as they would want to based on their liking of our training.
What kind of financial commitment was required from the institution to sustain this program?
The program offers $10,000 a year for the first 3 years of the residency training. So the commitment required would be per trainee in at $30,000. On an annual basis, it would be based on the number of trainees qualifying for the stipend, each needing $10,000.
Finally, what options exist for other teaching institutions that are interested in implementing a similar program but don't perhaps have the same resources as Mass General Brigham?
I think this is an important area for institutions to be thinking about in terms of reducing barriers. And Philanthropy actually is one way to try to fund this kind of program. The other is to think about existing funding, existing budget that's already going towards GME and utilizing some portion of that to fund a program like this.
Thank you, Dr. Koh.